Everybody want to give a shout out and where they are right now?
I'm Rahi, I'm in New York.
I'm Vanessa, I'm in Los Angeles.
I'm Sarah, I'm in Santa Monica.
I'm Jamie. Oh, I was like, I'm gonna interrupt someone. I'm Mona, I'm in New Jersey.
Jamie, where are you?
Oh, sorry. Jamie, I'm in Brooklyn.
And I'm Shahin Ghadir, I'm in Los Angeles right now. And with that being said, I would love to go ahead and get started. I'm so honored to have such an amazing panel of people here today to talk about fertility and empowering women and doing all the right things right now. We're going through some times that are absolutely completely different than anything that anyone experienced in the past. But it's not a time to forget what's most important for women. I am Shahin Ghadir. I'm a fertility specialist at Southern California Reproductive Center. I've dedicated my life to helping people build their families. In the last decade, things changed from just helping people build their families, but we now help protect people's futures and their ability to continue to have families when they wanted to, and allow women to go after their careers, their goals, and to do what they need to do. We also help men. We have a lot of LGBT patients coming to our office. We help people with egg donation. We help people with sperm donation and surrogacy and everything that's involved in that process. We help people, women freeze their eggs in order to use them in the future. We also help men freeze their sperm because studies have shown that, it can affect men as well if they wait too long to have babies. So these are all the things that we're doing here in our practice. Southern California Reproductive Center is affiliated with both UCLA and Cedars-Sinai Medical Center. So we have a lot of great affiliation, and we have one of the largest IVF labs with one of the highest success rates in the country here on the West Coast. And I'm glad that some of you guys are familiar with our practice, and I hope that the people who are watching today are going to have the opportunity to learn a lot more about what we have to offer and also learn a lot more from my amazing panel today. So I'm going to go ahead and start introducing my panelists. I'm going to start off with Sarah Haley. Sarah is an exercise specialist. She is a celebrity trainer. She's based in Santa Monica, California, right down the street from me. She is one of Instagram's top fitness gurus, and she has an amazing on-demand fitness platform as well. She specializes also in pre and postnatal fitness, which for me is incredibly important. She's a mother of 4, and she has a little 6-month-old at home. So thank you very much for making the time to even be on this panel. So we appreciate that so much.
Oh, thank you for having me. Like you said, I'm based in California. I'm a Midwesterner at heart, and I used to live in New York. So I kind of have my heart in all places. I am first and foremost a mother. My kids are 9, almost 6, almost 3, and then my newest is 6 months old. So I have spent the last decade having babies. I am done, hopefully. And I specialize in pre and postnatal exercise. I've been in the fitness industry for over 20 years and specializing in pre and postnatal for over a decade. So as you can imagine, I have worked with many people who are preparing to have a baby, as well as gone through their pregnancy and postpartum recovery and beyond. I am now mostly with my kids, and so I do everything virtually, which I'm used to living in the times that we are right now. So I get a lot of fertility questions via social media and email. I think I'll just touch on it, and I'm sure we'll talk about it more. But my biggest piece of advice, if you are preparing to have a baby, is to get in the best shape of your life with moderation. So without overdoing anything. I think when I often get asked, is there anything that I can do to help with fertility when it comes to exercise, is I would say, look at what you're doing. If you happen to fall on the end of over-exercising, fitness fanatic, fitness trainer, athlete, dancer, etc., look at what you're doing and see if there's anything that you might be overdoing. And then on the reverse end of things, if you aren't exercising at all, to definitely start getting your body in good shape on all ends, whether that's, and I'm sure everybody here has their expertise they can touch on, but sleep, nutrition, exercise, etc.
That's wonderful. Thank you so much. And I can't wait to get into a little bit more detail about what you recommend as well. The next person I have the pleasure of introducing is Dr. Mona Vand. Mona has a background in pharmacy that has helped really move her forward into her career, which has been more based in health and wellness, but with the expertise that she has in pharmacy. She is also a strong believer that food is the most powerful medicine, and this allows for healthy lifestyles and makes her a true expert in that area. Hi, Mona.
Hi, thanks so much for having me. This is so fun, this little panel. Like you mentioned, I used to be a pharmacist, so I went to pharmacy school. I practiced for 8 years, but it definitely wasn't my calling. I loved the information that I learned and just understanding how the body worked, how we metabolize drugs and food, but I didn't love kind of the day-to-day of just dispensing medication to kind of put a Band-Aid on everything. So I started exploring a more holistic route. And I always say, like, the things that I learned in school aren't so far off from what I believe in now. We actually learn that first line of anything is to do lifestyle modifications and diet and exercise, but too much in practice, people just, want to take a pill because it's easier. So I was really passionate about that. And I noticed that when I was working, my favorite part of the day was when people would ask me questions and I'd have to go on and actually explain to them why they're taking something or what to look for. So now my full career is digital. So I just produce content all day long, YouTube, Instagram, TikTok, and that's what I love sharing. So I'd love to get into how you can just keep your mind, body, spirit feeling the best so that you can be in the best position to get pregnant.
Thank you. Thank you so much, Mona. Fantastic. So Dr. Rahi is normally from Los Angeles, but she moved to New York City to help out in the hospital, and we are really honored to have you on this panel. She is an internist by her training in medical school, but she continued to get more training in aesthetics and especially in integrative medicine. She is also involved with a lot of health and beauty and wellness, which is her true passion, and she brings a lot when it comes to integrative medicine to patients. Hi, how are you?
Good, thank you. That was such a great intro. Thank you. I appreciate it. So I practice integrative medicine. That's my passion. And what integrative medicine is and what I want to discuss today is that it's a comprehensive and holistic approach to your health. And I find that really important, especially for someone who wants to optimize their fertility, to have a comprehensive evaluation of their health, to evaluate your hormones, your vitamins, your lifestyle, nutrition, to ensure that everything is balanced in order for you to be able to become pregnant and carry that pregnancy through healthy. And so my top 5 recommendations right now when considering fertility are ensuring that you get your labs checked. Micronutrient testing I find is super important. Ensuring your hormone levels are checked to ensure all of that is balanced. Vitamin D levels are super important. I recommend supplementation with vitamin D. Most people are deficient, and I would really recommend checking your levels because this is a vitamin that you can overdose on, and that will help strengthen your immune system and also balance your hormones. I also recommend magnesium and ensuring that you're on a good prenatal multivitamin with folic acid. And lastly, I recommend the importance of having a really healthy lifestyle, including meditation, exercise, and yoga.
Fantastic. Oh God, I love that. My to-do list is getting longer and longer just listening to you guys. Vanessa Bennett. Hi, Vanessa. Vanessa started off her career as a therapist and little by little shifted to a more mindfulness coach and psychotherapy. She is a yoga and meditation expert as well. I love that the fact that her soul consciousness manner to a healthy lifestyle is what she preaches to people. I'm also honored that she has a 13-week-old little baby and she was able to make this to this panel. So first of all, congratulations to you. And on a different note, congratulations to getting your baby sleeping through the night. We'll have to, in a year or two from now, when we do this panel again, all the people that got pregnant from listening to this panel and followed everyone's instructions, we're going to teach them how to sleep through the night as well. So welcome to the panel.
Thank you very much. I'm really happy to be here. Yeah. When that time comes, you guys hit me up, email me. I'll give you the specialist that I worked with. She's phenomenal. She changed my life. So my name is Vanessa Bennett, like you said, and I am currently a therapist in Los Angeles. I started my career actually in corporate. I lived in New York for many, many years and really burnt out, right? And I think the burnout that I experienced in the creative world as a producer, I finally, through my own therapy, my own spiritual journey, was able to realize it was actually anxiety, right? And a lot of people don't realize that burnout, which is such a common term, is an anxiety and depression-based, I don't want to say disease, but situation. So through my own therapy and my own journey, I became a therapist, and I do also teach yoga, and I'm a mindfulness coach and all the things. So for me, I always say it's a bottom down approach rather than a top down approach to therapy. Bottom down meaning the depths of our soul, right? So it's we've got to get in, we've got to do the soul work. And then for me, it goes up to the mind. And mindfulness to me is actually more soul oriented work. It's not just about changing behaviors. It really is about learning and understanding who you are at your depths. So I practice from a depth psychological background, and I bring mindfulness into everything I do. Yogic psychology, Buddhist psychology, that's really my background. And as far as, I'm resonating so much with what everybody is saying here. I think it's so important that mental health and wellness be on the same list as far as getting everything kind of in order and running in tip-top shape as your physical health, as your, as your nutrition, as whatever else you need to tackle. Mental health needs to be there just as much as the others. And I'll probably get into this a little bit more, but one of the things I like to tell clients when they come to me around motherhood, I actually work with a lot of women who are either in the beginning of this journey or who are actually a couple years post having a child, and they're now starting to work through identity stuff. So who am I now, right? Now that I'm a mother. And what I will say very quickly about my own journey was I never thought I wanted to have children. And I had met my partner, and we were just kind of like, oh, let's see what happens. And I really wasn't trying at all. Didn't want him. I was actually at a meditation retreat, and about 2 days in, I had this really powerful, just kind of feeling, this knowing where I said, no, I actually really want to do this with him. And it was the first time in my life I'd ever thought those thoughts, trust me. And lo and behold, that next week I got pregnant, and it had been over a year that we had been like not trying. So when I talk about kind of the importance of mental and spiritual health as well, it really does make a difference for everything to kind of be in alignment for you to, be able to be successful on this journey.
That's amazing. I love that. We definitely need to talk about this a little bit more, but just the power of the mind and what it can do to you, especially over these last 3 months when we've had time to reflect on our lives, has been so incredibly important. Realizing where we were and how life was beginning to take over. So it's been a very interesting journey these last 3 months about how our mind is so incredibly important and how we have to be in control and not let life control us.
Right.
With that being said, last but not least at all is Jamie Chung. Jamie, thank you so much. I know how incredibly busy you are. Jamie is an amazing wife, a beautiful model. She is a role model to many. She is my personal fertility advocate. She is a lovely, lovely human being that I've gotten to know. She is an actress in the upcoming HBO series, Lovecraft Country, and creator of whatthechung.com. And I'm so proud of her for being here and for being so open about her journey, about creating her embryos and about wanting to be a mom down the line. And thank you so much for sharing your story.
Thank you. I feel like the patient. I feel like I have so much more to gain than anyone else on this panel. So thank you to the smart, wonderful women that are a part of this panel. Vanessa, your story really spoke to me. I mean, I'm just going to jump right into it, but you mentioned that you never thought you wanted to have kids, and I felt the same way when I met my husband. I never dreamt of getting married or having a family. I was just very career driven and oriented, and I met Brian and I fell in love with him, and I knew that I wanted to have children, but I just didn't know when that time would come. And Dr. Ghadir, you mentioned like it's so important to have everything aligned, and I'm so glad that I froze my eggs with Dr. Ghadir last March, and it was such a powerful decision because I knew that I wanted to have children in the future with my husband. I just wanted all the options to be there, whether we adopt or have a surrogate or try to have babies through IVF. Everything needs to be aligned. And I have to say, just these past 3 months in quarantine, I finally turned a corner. Like, I'm not ready to just like jump and get pregnant, but now I know I need to have everything in order for me to have a successful, healthy pregnancy and post-pregnancy. I think that's the most important thing, because a lot of people don't talk about post-pregnancy, and the challenges there. So I'm so excited to dive into this conversation.
Yeah, so thank you. I love that. And thank you again for being so open about your journey with everyone. When people have these open journeys and they talk to it and their voice is heard, you guys don't understand how much it helps patients that are coming into my office and the things that they tell me. And when I tell people that I had to do IVF and I have twins from IVF and my wife and I had our, issues at times, just a little thing like that. And when patients say that meant so much that you shared that with me, so that you understand where I'm coming from, is great. What I wanted to start off with is that, Sarah, 3 months ago, I was in the absolute worst physical shape that I had ever been in my life. I thought, okay, this is it. I'm 48 years old, and from here, I'm going to go downhill, and I'm just become one of those overweight middle-aged men, and that's it. I learned and forced myself when things were really quiet and nothing going on in the practice and everything was just in lockdown. I went from being able to jog 3 minutes, and I'm very proud that now I can jog 2 miles. And I did it in about 18
Wow.
minutes, which I wasn't ever able to do even in high school. So I'm everyone who knows me well knows I'm not that athlete. I ski and I play tennis and I drag myself to the gym. But I would like you to tell people that are not very athletic or not in good shape or who have some pounds to shed, what is a nice way of beginning this process that's not overwhelming?
Well, not jumping in and going straight to like the 5K, right? My phrase, especially since I've become a mother, is something is always better than nothing.
Yes.
So, because no one's going to go to bed and say, oh man, those 10 squats I did, what a waste. You're going to go to bed being like, oh, I didn't do anything. I didn't move my body today. And I think there, in the times that we're in right now, there are two scenarios. It's either, I'm sitting down because I'm so sad about what's happening, or I'm being proactive and taking advantage of all this time that we have and doing something to get our bodies healthier and in a better place, especially if you are thinking about having a baby. So I would start with baby steps. I have on my website, and if you want to link out to this, it's sarahhaley.com/excuse-proof. And it's a 5-minute workout. And I give modifications. I mean, everything I do, I always give modifications for pregnancy and postpartum. And just to start with the 5 minutes a day and do something that's going to make your heart work a little harder. So that's some sort of cardio move, like a jumping jack or taking a walk. And that's something that's going to work your lower body, like a squat. And that's something that's going to work your upper body, like a push-up. And actually, I'm not going to even go to the core because those push-ups, the push-ups and the squats are going to actually work your core. So we won't even add that part in. But I think the biggest thing is to get yourself a little uncomfortable. I always like to share the story of my mom, who is now in wonderful shape. She's 7. She just turned 70 this year. And right around 60, she said to me, she said, Sarah, I just feel like I've put on this weight and I can't get it off, and I just don't feel good in my clothes anymore. It wasn't really about a number game, right? It was, I just don't feel good and I want to be healthy for my grandchildren. And I said, Mom, at any point when you're working out, does it feel a little bit hard to breathe? And she said, no, why would I do that? And I think that's what people have to understand, is just sitting and doing this is not what I'm talking about. I'm talking about doing something that's going to escalate your heart rate and make your heart healthier. So that is when you're walking, if you're going out for a walk, at some point during your walk, say, every 2 minutes, I'm going to walk really fast for 30 seconds so that it gets harder to breathe. Not painful, but a little bit uncomfortable. And then I'm going to recover from that and then maybe do that 3 or 4 more times on your walk.
What do you think of, so one of the biggest challenges I have for patients of mine that have to lose weight, I read an article years ago that said the run-walk method is a great way to burst your body and kind of lose calories and lose fat in a good way. So I ask people, can you run for 1 minute? And if they tell me that they can run for 1 minute, I tell them that I want you to run for 1 minute and then walk for 1 minute. And I want you to do that cycle for about 15 or 20 minutes if you can, and then progressively you can do 1 minute of walking, then 2 minutes of running, and then 1 minute of walking, and then 3 minutes of running. What do you think about that one?
I love it, and I would say even start with smaller increments.
Okay.
Run for 30 seconds and then walk for 2. Having had 4 vaginal births myself, you can imagine my pelvic floor is not what it once was, even with all the work that I've done. And so for me, I am really good at sprinting and I'm really good at walking fast, but the constant impact does not feel great on my body anymore. So I would say even that, start by running for 15, 20, 30 seconds, and then a minute of recovery. Working really hard in shorter increments of time is often more effective. Some people know it as HIIT training, high intensity interval training, and that doesn't mean high impact. So if high impact is not your thing, that's not what I'm talking about. I'm talking about what we've just discussed, like getting yourself in a place where your heart is working harder than it does the rest of the day. So I love your method. I would just say it doesn't necessarily have to be a minute. It could be shorter than that, but it needs to be working hard.
Okay, wonderful. So those are good baby steps for getting moving, and everyone can get moving. It's just an important thing that we can just get moving, doing anything. Even, I didn't know you had an amazing 5-minute workout. I do this thing called the 7-minute workout sometimes when I just really don't have time.
Yeah, I'm familiar.
I think I found my new favorite. 5 minutes is even better than 7 minutes. So that's
or even, what I did the other night, what are they? EM, OM, I think every minute on the minute. I had not done what I was just talking about at all. I had not done any sort of cardiovascular activity, and most of the people in my house were asleep. So if you're familiar with a mountain climber, for 10 minutes, I set my clock for 10 minutes, and I decided on 40 mountain climbers. Okay, that's 20 knees in on each leg. It's basically like a push-up, but you're running your knees in, right? If you're not familiar with the mountain climber. And every minute on the minute, I did 40 of those, and then I rested. So does that make sense?
Yeah, that's great.
And then I would rest for the rest of the minute. So if I could do those 40 mountain climbers in 20 seconds, then I got to rest for 40 seconds. Yeah, and so try that. Every minute on the minute, choose a favorite exercise. It could be jumping rope, it could be jumping jacks, it could be running in place.
You're going to go to bed thinking about the amazing thing that you did. And you got to start small. I love the idea of starting with baby steps. So that's wonderful. Vanessa, what would you say is an important thing to do mentally? Because I think we all agree that the mental aspect of your well-being, whether it's to get pregnant or just to be yourself or just to be able to understand and handle the challenges of a career and today's lifestyle, what do you recommend as baby steps to taking control of your mental state?
Well, first off, I want to say that a lot of times we use words that are like control, right? And I actually think that sometimes we put a little bit too much of like, I need to control this or I need to fix this on our mental well-being or our spiritual well-being. And I think a lot of times I would say to clients, first and foremost with mindfulness, it's not about actually changing. It's just about watching and observing, right? And through the watching, observing, and learning how you function, what your patterns are, things naturally change and things naturally soften, and you become a more present person and a more kind of happy person actually over time. And what I do with clients a lot of times is I pay attention to how often they are trying to do black and white thinking, or like it's either I'm controlling it or I'm a failure, right? I'm either meditating for 20 minutes sitting on a cushion every morning in silence, or I'm not meditating at all. And that I think is actually, as I'm talking it out, that's probably one of the baby steps I would give, is that don't feel like in order to kind of meditate and be mindful, you need to be sitting like a yogi, right, in lotus position, because that's not what it's about, right? You can be meditating when you're doing the dishes in the morning. You can be meditating the 5 minutes that you take the garbage out in the morning. And so a lot of times when I work with clients, it's about infusing little bits of mindfulness throughout your day, because the reality is mindfulness, it's like a muscle, right? You're never gonna go to the gym and do 10 curls and expect to walk out with a huge bicep. That's not how it works. It's little increments every day that strengthen it slowly over time. And so if you're able to do something like let's use the dishes, for example, right? What I would say to a client is, okay, You turn the water on, you feel yourself put the gloves on, you test your water temperature, you actually notice to yourself, oh, the water is warm, you feel it on your skin, you feel the sponge in your hand, you smell the soap smell, right? You notice the suds, you wash the dishes. This is tedious, I know it sounds like it, but that's what mindfulness is. If you're washing the dishes, wash the dishes. If you're brushing your teeth, brush your teeth, right? One of my teachers actually used to use this saying, next time you're in the shower, check and see if you're actually in the shower, right? How many of us are in the shower, we're planning out our day, or we're thinking about that conversation that we had with somebody that went the wrong way, or we wish we had said this, or whatever. Next time you're in the shower, check and see if you're there, right? Are you feeling the loofah on your skin? Are you smelling the soap again? So as far as baby steps, I think that is actually one of the, I don't want to say it's easy, because mindfulness is not easy, but it's one of the easiest ways, I guess, to get this going as a practice, right, throughout your day.
That is so powerful. So a couple of things I just wanted to add there, Vanessa, and I love that. I absolutely love that, because I think it's just so ignored. The mental aspect and the mindfulness aspect of life is so ignored because it's not so tangible, and we can't ignore it any longer. But one of the things is I've realized that there are apps where you could do like a 2-minute or 3-minute, like literally 2 or 3 minutes of just meditation, where I have been having the craziest, most stressful day, and I took like 3 minutes out of my day and I completely came out of it reset. Right. So that is absolutely amazing. I've just, because I didn't really do this often, but now that I have time and I started to like just jog around my neighborhood when I see a lot of other people jogging, yep. I've been like, whoa, I just smelled some like flowers.
The jasmine.
I never realized how nice that house was, or their lawn is so ugly, or they do this so quick. I mean, I just didn't even realize these things. And I take my 8-year-old son with me, and he's like an architectural consultant now. And I know exactly what he thinks about every house, and just observing the world around you, I think is just so unbelievably important. And I've lived in this area for 5 years and never noticed things that I've been noticing in the last few months on a brisk walk while I'm jogging or walking and my kids are on their scooters or just going alone for a little bit. So I think that is so.
You know, it's funny that you say that. I actually posted something on my Instagram the other day. Well, it was a couple weeks ago, because I think the baby was about 8 weeks old. And I said, you know, coming from a mindfulness teacher, somebody who's been doing this for a very long time, meditation, I said my 8-week-old is reteaching me how to meditate. And what, you know, I actually talked about how we've been going on these walks around the neighborhood, right? And at the time I had her in the carrier, and just to see everything through her eyes, right? It's what we call the beginner's mind, which is a term we use in mindfulness. And it's to see everything, and like you're seeing it for the first time. And I was looking through her eyes, like we would stop at every tree and every, you know, car or signpost or house, and she just would inspect it and stare at it. And so I was doing the same thing with her. And that is mindfulness. That is meditation, right? It is noticing the colors and noticing the smells and noticing the, you know, the visual way that the house roof comes together, all of those things. And when you notice your mind wander, because it will, it's what the mind does, you notice that it's done that, and then you bring it right back. And that's all it takes.
We should all sometimes put us in our newborn bodies when we're observing things for the absolute first time ever.
They are our greatest teachers, right?
You know, I have a 3-year-old and I have 3 older kids that are 11, 8, and 8. They're twins. My twins are from the IVF, and a 3-year-old little surprise. And my kids sometimes remind me of things that my little one is seeing for the first time in her life. And the fact that they're cognizant of like, oh, Charlotte may never have seen this before or done this before, you know, it's interesting, and it's a nice way to look at things. Thank you so much. Mona, I'd love for you to tell us, okay, if you were going to be beginning your parenting process right now, what would you recommend from the way that you approach things would be the best suggestions for someone to do right now? And Rahi, I want you to pay attention, because that's going to be a very similar question for you very soon.
You know, already what these other women have said, I'm just so aligned with, because I think there's so many things that go into living a healthy life and wellness. I think oftentimes people will just think of like your physical health, or, you know, your mental health, or, you know, your spiritual health, but everything is connected. So I'd love to get into a few different categories of it. I think supplement wise, that's a question a lot of people have, because they just want to know, should I be taking, you know, like a prenatal supplement? I've had some people ask me if there's even like a diet that can help fertility. So first and foremost, the healthier your body is, the better it will work for you. So when you're eating clean, when you're exercising, a clean diet is my biggest thing. Supplementation, you and I actually talked about this on our live, how CoQ10 can be really helpful for someone who wants to get pregnant for a few different reasons. And I also really like looking at things directly and indirectly. So, directly, it can reduce inflammation. It's good for your heart health. So most everyone that's in the healthcare field knows that inflammation is like basically the leading cause of almost every disease state. So anytime we can naturally or with supplementation reduce inflammation, that's great. So it's just going to put you into a healthier state. But it's also cool because it's kind of shown to help reduce different endocrine disruption. So one study showed that it can actually reduce the hormonal effects you could get from BPA. So, we'll see like BPA-free plastic or cans, and we're learning how much that can affect our endocrine system, and our hormones impact everything, especially pregnancy. So taking something like that could be really helpful as a supplement. Stress.
Can you repeat the name of the supplement because someone's asking?
Oh, sure. It's coenzyme Q10, but you'll see it oftentimes as just CoQ10. So you can get it. I mean, I think you have a cheat sheet of a specific one you recommend.
I have a post a couple of weeks ago, and it says CoQ10 and the doses that's recommended. I like to see exactly which. When I'm talking to patients in consultations, then I kind of decide which brand I think would be a best fit for them. But sorry, I didn't mean to interrupt you.
No, I'm glad. I can't see the question, so I'm glad you brought that up.
By the way, people are popping up saying hello from around the world, and I don't know if everyone's seeing.
Cool. I'm not seeing anything. I don't know if you guys are.
People are saying hi from all over and telling you guys how much they're loving what you're saying, by the way.
That's awesome. Hi.
So sorry. So we were doing the CoQ10. So prenatal CoQ10. What about omega-3s?
Omega-3s, yes, but there's a specific kind I think that you recommend, right? Because that's another thing that can get a little bit confusing about supplements is like what kind is better, if there's a DHA or EPA, which kind do you usually recommend for your patients? Because
I recommend a plant-based DHA because I realize that the fish-based ones, it's very, very difficult to find one that's mercury-free. And if you're going to be taking this, and I recommend for most of my reproductive aged women to be taking a prenatal vitamin and an omega-3 DHA. And if you're going to be taking this for like 3 to 5 years before even trying to conceive as your multivitamin, that's a lot of mercury. And unfortunately, where these fish are coming from, it's not mercury-free. And so that's why I did the plant-based one now. And the CoQ10, what's important about the CoQ10 is that all the studies that have related coenzyme Q10 or CoQ10 has been related purely to the ubiquinol formulation, which is the purest form of CoQ10. So CoQ10 is rather expensive wherever you find it, but if you're finding it and it doesn't say the word ubiquinol on it, I wouldn't waste my money buying it.
So look at the back of the supplement under active ingredient. You never want to just look at the front. The label is oftentimes a lot of marketing, which is why you can see Tylenol cold and flu. You could see that same label on a bunch of different bottles with completely different ingredients in the back. So always just turn it over and look under active ingredients. Then it begins with a U.
Ubiquinol. It's a hard word, but it's the ubiquinol that's really good. I got to tell you, ubiquinol 600 milligrams a day has been shown to slow down the aging of eggs. So nothing in the world makes new eggs, but instead of your eggs declining at the rapid rate that they do in your 30s, it really slows things down. And if there's ever an issue with sperm well-being, studies have shown that 200 milligrams of ubiquinol CoQ10 is also one of a strong antioxidant powers on the well-being of sperm as well. CoQ10 is an antioxidant, so it reduces the oxidative damage of all of the cells in our body, and that's kind of an anti-aging method, and it affects eggs, and that's why it slows down that process as well. And talking about antioxidants, Dr. Rahi, I'd love to hear your perspective on the integrative ways of trying to make this beneficial for someone in their fertility prone years.
Yeah, so so the integrative perspective, as I was saying before, I offer specific micronutrient testing, and I know a lot of integrative practitioners offer that. And that way you can actually see if you're deficient in certain vitamins, minerals, antioxidants to really target the ones that you are deficient in and supplement with that. Because the problem sometimes with supplementation, because I love supplements too, I take a ton and I always recommend them, but the one problem is you don't know, if you're deficient and if you're overdosing, that you got to be really careful. Just because they're over the counter doesn't necessarily mean that they're safe. So it's very important to ensure that your levels are monitored throughout in order to not overdose or underdose. The other thing about supplements, as Mona was saying, is you don't know the quality, which quality is, which supplement provides what quality to you, and it's really important to find a line that is pure and clean. So to ensure that once your hormones and your nutrients and micronutrients are balanced, that will allow your body to be more fertile.
Okay, great. So I think micronutrient testing is definitely going to start becoming more and more available to people around the world, or especially in our country. I think it's really important. When we're talking about micronutrient testing, it checks you for so many things that your primary care doctor is not checking you for, like a vitamin D. We have all in the last couple of days, I've heard in the news how there's a strong relation with vitamin D deficiency and being more prone to potentially getting the coronavirus. And for the first time ever in the last month, I have seen a lot of people having their vitamin D, because I check it on everyone that walks into the door. I've been seeing a lot of normal levels. So I think people have been on top of this and understanding that vitamin D deficiency affects so many things, including fertility and including egg quality and including implantation, and now even your mental capabilities as well, Vanessa. So important, and also now showing that it can reduce your chances of getting corona if you are not deficient. And it's so easy to take. But like Dr. Rahi said, overdosing on vitamin D is a problem and can cause toxicity as well. So be very careful and don't just take the highest dose without knowing what your level is. And it's really important to kind of follow guidelines of your physician on how much you should be taking. So thank you.
Thank you. And get your levels checked every 3 months. That's usually what I recommend.
Oh, that's really good. That's really good. We usually do it in the beginning. If it's really low and we put them on a high dose vitamin D, we usually have them check it again in a month. But I think, every 3 months is easy, and there's so many labs around these days that you can jump into. Right now, even with Corona going on, our office is now open and we can do testing for patients. It's on a different way that we were in the past, with lovely masks and gloves and temperature checks before you can even enter our clinic. But yes, things like that are available. Jamie, when you came in to preserve your fertility for the future, boy, it was a different world than it is right now. People in our waiting area are spread out to different corners. We're bringing people in on different hours of the day, so it's really spread out. In our IVF lab in the surgery center, we are skipping beds in our recovery room, so you are really spaced about 15 feet away from someone else in the pre-op and post-op areas. I wanted you to kind of let people know, you could go whatever angle you want, but I'd love for people to know some of the reasons why someone who has a career that's flourishing so rapidly and beautifully like yourself, why doing something about your fertility was the right thing for you and why you would recommend it for someone.
I had been married for 5 years before I decided I wanted to freeze my embryos. My husband and I have been married 5 years, but we only spent collectively, I think, 1 year together in the same city. And so we don't spend a lot of time together. And, my 36th birthday at the time was rapidly approaching, and I kind of had a freak out, to be quite honest. I didn't want to slow down in order, as an actor, if you are pregnant, unless you're a series regular, like, you would have to take the proper time off. And, it felt quite selfish when I was considering it to try and have it all. I want a family in the future. I want my career. And the more I thought about it, the more, I shouldn't be so hard on myself. I think it's okay to want to have the career and want to have the family in the future. And to be quite honest, I thought it was going to buy me a little bit more time with my husband, who's a little bit older than me. He's like 5 years older than me. But after the egg retrieval, it made him want a baby so bad. And so I'm glad I have, our embryos. on ice. But I don't know. I think this time to finally, as an actor, you want to be present in the scene. It's the most important thing to be present. But I didn't really I didn't work on that in my personal life, you know? And so these past 3 months, I've really had time to just settle down and root myself and focus on my mental well-being and really answer the hard questions that I've been avoiding in therapy with my partner. Just like, why don't you want to have kids yet? What are you afraid of? And so these past 3 months have really enlightened me of like what it would be like to have a family. Or I don't know, I think the silver lining with coronavirus is that I definitely do want a family. And when I froze my eggs, I was still on a bubble. It's like, maybe I want kids one day, I'm not sure. But yeah, the last 3 months a light bulb went off and I turned the corner and I'm like, wow, I think I am really ready to start a family, you know? And that's a big decision. Like, I don't want to just, yay, get pregnant, but I'm ready to take the next steps to prepare my body and my mind for possibly a pregnancy. So,
and I think what Jamie, you're saying is so important, because I had never ever gotten so many messages sent to me from my Instagram page alone. So I realized that people are spending a lot of time trying to learn about the most important areas of their life, whether it's fertility or whether it's something else. I've had my own searches for things that I had desires to learn more about. But people are giving some reflection on what's kind of important for them when you're home for 2 to 3 months, doing nothing that you're normally doing on a regular basis. And to ensure that your family is taken care of and your future is taken care of is really important. Jamie, you said a couple things that I wanted to clarify for our audience. One is egg freezing and one is embryo freezing.
Oh, yes. Well, we first.
Jamie is a great husband. She didn't only spend 1 out of 5 years with him by choice. I'm sure she'd spent every single minute with him because he's one of the coolest guys that I've met.
Oh, yes, we're both actors, and we both spend a lot of time in different cities. But to correct what I said earlier, we froze our embryos. And Dr. Ghadir, you suggested that because it's a better chance of a successful IVF. Is that correct?
So I'm going to explain to our audience exactly what the difference is. So if you're single and you are waiting for the appropriate male sperm, whether it's a frozen sperm or a partner or a husband, it's probably better to freeze your eggs. We have had some amazing successes of patients up to the age of 44 that froze their eggs and have come back, used them, and have already had a beautiful baby from them. We have some patients of ours that have been very open about it on social media and doing Instagram lives with me. And for most people that hit the age of 30, we recommend, if they have not yet, to make sure they get an assessment of where their fertility is. And what I mean is that there's a blood test called AMH, anti-Müllerian hormone. It's a simple blood test that can be done on any day of the month, whether you're on birth control or not on birth control pill. That simple blood test can be interpreted ideally by your OBGYN, or if you're not getting the feedback you want, for sure by a fertility specialist, to let you know how you're doing. It's a perfect way to monitor where you are. We have people that just call me and say, hey doc, can I jump in this year and see where my AMH is and see if it's changed? But by the age of 30, because we know that there's a significant decline in fertility that begins for most women around 26, 27, 28, which is shocking, okay? But that decline begins then, and it begins to become a little bit more rapid every year, with a rather large pickup after the age of 35. So we tell people at the age of 30 to assess where they are in life. So if you're not sure, but you want to leave doors open, it's a perfect time. In the beginning, about 10 years ago, when egg freezing was beginning to become a big aspect of fertility specialist practices, I was having a lot of people running in at 39 and a half years of age before their 40th came around, freaking out. And that is not the time that you want to be proactive. So many women these days are coming at 30, 31, and I'm so proud of women for being proactive and trying to do this at a younger age, because the younger you are, the better your egg quality and the more eggs you get. I had one patient of mine freeze her eggs 5 times. She said, I want to make sure I do everything to have as many kids as I choose to when the time comes. And the sad thing is we've also learned that some 30-year-olds have already had a significant decline in their fertility that they would never be aware of. And when I do consultations, people are like, but my mom had no problems and there's 3 of us. Well, many of our moms started to have us in their early 20s, not in their early 30s. So it's made a very big difference for how families were created at that time. So it's one really important aspect.
My mother had me at 39.
You did?
Well, she got pregnant with me at 39, so
wow.
she was very late in life. So
that is proven genetics.
Yeah.
But many of us that come in at 39 and they said their moms had them in their early 20s, but she had great fertility. It's difficult to kind of pass that on, and it's not always hereditary. So that is 39 is great. If you get pregnant at 39 and have a healthy pregnancy, God bless you, because I see the number one average age of patients coming into our offices with people having difficulties is 39 years of age.
Dr. Ghadir, there was a question from a woman named Emily. Can you touch up on embryo grading?
Absolutely. And so that's egg freezing for single women. And then when you have a couple that's not ready to have a baby, and there's a male and a female, or there is a lesbian couple that's going to use sperm no matter what in the future, we make embryos. That's when we put the egg and the sperm together. And once we put the egg and the sperm together, we make an embryo. The benefit of making the embryo, and I'm going to get to the grading as a result of that, is that these embryos get to grow for about a week in our IVF lab, and we get to visualize how well they're doing. Those embryos that are growing well get a grade. In our office, it's really simple. So you, Emily, are going to a clinic that does an older version of grading where they give A's and B's and C's and numbers, and it makes it very difficult. Our office, you have to have an embryo that makes it to the full-grown stage. It's called the blastocyst. Once the blastocyst is popping open at its edge, which is called a hatching blastocyst, we're able to do a tiny little biopsy from the outside. And if it's graded good, fair, or poor, those are our 3 grades. We did this years ago to make it very simple because it was getting very complicated, and every embryologist saw things a little differently. But with the good, fair, and poor, any embryo that's a good or a fair, it's in the game and it can make a beautiful baby. 99.99% of poor graded embryos are no longer kind of in the game, so we don't really want to biopsy them and keep them there. So for those embryos, we are able to do a tiny little biopsy, and then the biopsy goes out for genetic testing, and usually within a week to 2 weeks, we get the results of the genetically normal embryos, and it also gives the gender. It also tells you which ones are abnormal and exactly which abnormalities are there. So in terms of grading of the embryos, I would definitely get your doctor's perspective, because for some clinics, a 4BC is good. For some clinics, a 4BC is really below average. And for some clinics, it's above average. So I would definitely talk to your own doctor's office. If patients of our clinic, I tell people, as long as you have good and as long as you have fair, you're 100% in the game. And we are perfectly happy to biopsy those and freeze them and keep them there for the future. So we have no issues whatsoever. And now that you jumped to that question, Jamie, I'm going to jump to a couple. I actually wanted to give everyone the opportunity. I know that people have been sending you messages asking questions. So I want you to pick and I didn't realize how fast time would be going and how much fun we're having, but I wanted to go ahead and have every guys touch base on one of the best question that you got in the last couple of weeks that you want to touch on. Sarah, do you want to start?
Sure. I think I get asked most often, what type of exercise should I be doing if I want to get pregnant? And my best advice for that is, if you want to be pregnant, to start treating your body like it's already pregnant. So for me, personally, I'll use myself as an example. I love a good hot yoga class. Over the past decade, when I was trying to get pregnant, I did not go to hot yoga. I do not recommend hot yoga when you're pregnant. I know that could be controversial, but as a pre- and postnatal exercise specialist, I do not recommend that. So even when I was trying to get pregnant, I refrained from hot yoga. I did regular yoga. I have something on my site. You can go to freepregnancyworkouts.com. So if you're interested in seeing what pregnancy workouts look like, you could go to freepregnancyworkouts.com and look at that if you're thinking about getting pregnant. But that would be my number one piece of advice, is start treating your body that way. So for instance, if you are a marathon runner, that might mean cutting your run shorter, maybe a little less intensity. Whatever it is, again, I think I touched on this before, you think you're doing too much of. Are you exercising 2 hours a day? Would I recommend that if you were pregnant? Probably not, because you're not trying to lose weight when you're pregnant. So I would look at your exercise schedule and say, and that might mean you don't have an exercise schedule. Because a lot of people come to me too and say, hey, Sarah, I haven't been exercising. Now I'm pregnant and I really want to be healthy for me and my baby. What should I do? Start an exercise program, and I have tons of pregnancy workouts on sarahhaley.com. So that would be my number one piece of advice. Again, I'm going to say it again. Start treating your body like it's already pregnant if you want to be pregnant.
I think that's really, really good advice. Vanessa, what is the number one question that you get that you'd love to answer?
You know, I think for me, a lot of people that I work with are either somewhere along the journey or have already had kids. Like I said before, it's a lot of identity stuff, right? So to kind of take it to like the mental health area, most people are asking me, how can I balance work with this? How can I make sure that my partner and I are as strong and solid as we can be before we do this? It's a lot of how can I's, right? And so my suggestions really along that would be, start your journey. I like what you said, Sarah, about almost treating your body as if it's already pregnant. If this is something that you're really, really serious about, I would say take that same angle with your mental health, right? Because here's the thing, you investing in yourself emotionally and mentally is going to be of nothing but not only benefit for you physically, right? Because it's all connected. So if you're trying to get pregnant, but also how you show up as a parent, how you show up as a partner, right? I mean, so many of us can probably name a few things that our parents did that we're saying to ourselves, I would never do that, right? I'm going to let that one go. There's things that I take from my mom that I know that I implement, I use with my kids, and there are things that I'm like, nope, not doing that. And one of the beautiful things about really working with a therapist or a coach is that you can get in and start doing some digging now before you have that baby, hopefully, right? And start learning and unlearning some of these habits that might come from past generations, or might come from trauma, or might come from experiences that you've had. Let's get in there. Let's learn to be a better communicator. Let's learn to be a more emotionally kind of stable or well-rounded parent, because let's be real, kids test us in every possible way, right? And they are a mirror to us. So anything that you have not worked through, that child will turn that mirror on you, and you will be forced to look at it. Whether or not you want to work through it is another question, but you'll be forced to look at it. So one of the things I talk to people when it has to do anything with pregnancy or childbearing or rearing or whatever, is you're not just doing this for you, you're doing this for them, and how important that is to take the mental health part into consideration.
Oh, that's such great advice. Thank you so much. Mona, what's the question that people ask you the most, or have asked during this last couple of weeks that have sent you in advance?
I actually think overall the question I've gotten the most is beauty products, skincare products. Like, can I use this while I'm pregnant? Like, I know the whole clean beauty, non-toxic world is still a little bit gray, and we're still learning about it. But I do find it really interesting that people always ask that, and they care when they're pregnant, but they don't care as much when they're not pregnant. So, if there's a warning for a product that wouldn't be safe for your baby, like I think one lesson here is to treat yourself how you'd want to treat your baby, because you almost have to dig a little bit deeper and think like, why am I not being as good to myself as I am to, something I'm bringing into this world? So I always think that's really good to look at and to just kind of get in the habit of that as well, because it can be a little bit scary. And we've seen so much that the regulations in the US are just so much more lenient than almost everywhere else in the world. And people are catching on, and there's so many great things now available to us. So I would definitely recommend just trying to get into that habit now and just staying there, because we have a lot of options.
I can't tell you how many of my patients ask me these questions about the beauty products, which then I don't have really good resources. But from now on, I know exactly where to send them.
Mineral-based sunscreen, always. Nothing chemical.
Rahi, what's the question that you got the most before this happened?
How to be healthy in general and during pregnancy. And I would recommend creating a balance, just as everyone's sort of mentioned throughout the panel, creating a healthy balance throughout your life, including mind, body, and lifestyle. And sometimes that can be hard to achieve on your own. And that's why I always recommend working with a practitioner that you really trust to help you achieve exactly the right balance that's for you, because everyone's different.
And so balance is so important. That word is just important. Jamie, I'm really curious to know, after you were so open about your embryo creation journey, what's the question that you get the most from people?
How long does it take and did it hurt? Everyone's body is different. Like you suggested, go in for an AMH blood test to see the levels of your hormones. Is that correct?
Yep.
Okay, right. And then after that, you schedule a consultation. Dr. Ghadir, I think the cycle of, it was the proper time in my cycle to start the hormones right away. So I got really lucky. So it was very short. It was only like a week and a half, 2 weeks before I had my egg retrieval. And, it took me personally about a week and a half, 2 weeks to recover. You're just a little uncomfortable, you're hormonal, you're forcing your follicles to grow in order to produce as many eggs as possible. And it's a little uncomfortable, but it's worth it. It's 1 month of feeling, where everything is heightened, and then you're back to normal. But I will say there is one hormone growth medication that stings, and I don't remember.
There is one injection that is called Menopur. And it's a tiny needle like this big. And when it goes into, all of the injections are tiny needles.
They're small, yeah.
So in a way, I'm glad that the Menopur stings for a couple of seconds, because the number one phone call we get from people during the 10 to 12 days of injections that you do before your eggs are ready to come out is that I don't know if I'm getting these medicines, and I don't know if my body is receiving them.
Yeah.
And if this Menopur didn't sting a little bit, then I think every single patient of mine would be calling all day long saying, I think I'm not getting anything in me. But the proof is that when they come in for regular ultrasounds and blood checks as they're progressing into this process, the ultrasounds are showing eggs growing, hopefully a good number of eggs growing, and that's the proof of it. And all of the egg retrieval process is under anesthesia, which takes about 5 minutes, and people don't really feel or have a sensation or a memory of any of it. So that's the good news about it. I have so many questions that I got sent to me. This is just one of the sheets, and the questions are coming in here. Unfortunately, I want to say that we are running out of time. I want to thank everyone. What I do want to let everyone know is that our office is open. We are doing consultations with people around the entire world. These consultations that have been virtual by Skype and on the phone have been unbelievable for us, opening doors. People are getting prepared for when they can travel. Our local patients and even people in the neighboring states driving in and doing treatments. We are now open to do fertility treatments. Not every single patient can rush to the front of the line. We are letting people that have a need, have a decline in fertility, have an age-based issue kind of go to the front of the line. But we're available to do the consultations. You can go to our website and there's a place for going on, or a very fast way is if you want to send me a DM, which has your name and your email, date of birth, and phone number. I'm more than happy to get people in touch with you to schedule in a very rapid way to get you in for the consultations. This was, in my opinion, such a fantastic hour. I got such lovely, unbelievable perspectives from all 5 of you. I want to thank you guys absolutely so much for bringing so much from your area to this. And hopefully, as a result of this, we can set up maybe some Instagram lives where we're going back and forth and getting questions there. I'm so saddened that we couldn't answer more of these questions, but there was just so much to say today, but we won't ignore them. And again, people can send messages to my Instagram. I'm going to ask everyone to send me their information about their websites and where people can go to get more of this information that you guys were able to have today. That'd be great. And I want to wish you guys all the best in everything that you're doing right now in your own personal lives and in your own fertility lives as well. So thank you guys very much, and thank you everybody.
Thank you.
See you next time, guys.
Bye.
Thank
Bye,
you.
guys.